Well, hello. Um, my name's Pat Ryan, and I've been a registered nurse now for pretty much close to 10 years. I've worked in the emergency room, I worked in urgent care for the majority, so urgent care and ER, so pretty much acute care for my whole time as a registered nurse. Anyway, I wanted to make this video specifically geared towards registered nurses who are looking into transitioning into being a nurse practitioner, whether it's a family nurse practitioner, acute nurse practitioner, psych nurse practitioner, just advancing to the newer role of a provider than as the registered nurse. I'm currently going into my last semester for my family nurse practitioner. I am getting after that. I'm taking a year off. I am getting my DNP, my Doctorate of Nursing in Practice, but I will become a family nurse practitioner hopefully this summer after I take the boards and I pass it, and we'll go from there and see where I continue to work. I am doing a kind of like an externship in the emergency room as a nurse practitioner. I start next week and I'm pretty excited for it. We'll see how that goes and if that kind of transitions into a job and if I'll like it more of a nurse practitioner than I did as a registered nurse. Anyway, I wanted to make this video more on I feel like I want to let a lot of nurses understand the importance of experience as a registered nurse before you decide to look into going to family nurse practitioner school. What I've seen in the during my journey in nurse practitioner school and what I've seen beforehand with other nurse practitioners, that a lot go from being a registered nurse right into becoming a nurse practitioner. Maybe they're a nurse for a year, sometimes 2 years. I've seen as little as a few months. And I've seen nurses who never even worked as a nurse and just jumped right into nurse practitioner school. And I'll be honest, I never knew you could do that. I honestly never really knew much about the nurse practitioner role until I started working in the urgent care back in the end of back in 2019, in 2020. I really didn't understand the role when I worked in the ER, just because I was the nurse and I didn't really care about anything else but of what I was doing. And I understand that the role of the resident and the doctor, but you didn't really work with any nurse practitioners. I don't recall working close to any at that time, so I didn't really understand the role. But now that I've worked in an urgent care for close to 5 years now, I worked pretty close with nurse practitioners. It's usually a nurse practitioner, and a doctor, which is great for the nurse practitioners at where I work at because they get to work with a doctor and they get to ask questions and they get to kind of hone their skills with a doctor who has, of course, a lot more experience than a nurse practitioner. But I see what they were doing. I was kind of understanding, like, oh wow, like they were helping diagnose and treat. They were pretty much the provider, doing what the doctor was doing, but of course not as I wouldn't say as knowledgeable as a doctor. Of course, I mean, doctors go through a lot in medical school. They go through residency. They're more well prepared than a nurse practitioner is, which now brings me into the need for experience before going into becoming a nurse practitioner. Because like I said, you're going to be working as a provider. You're going to be taking care of people. People are going to come in with rashes. They're going to come in with, earaches or sore throats and, things that actually could be concerning depending on where you work. In an urgent care, people will be coming in with chest pain, and you have to distinguish, or am I going to send them home, or they go into the emergency room. Now, if you're someone with no nursing experience, I would believe that that's going to be very hard to transition over into a nurse practitioner. Obviously, there are people out there who do it, and more power to them. I don't know how their road is as a nurse practitioner, but I do see in my classes that a lot of my classmates will talk to me about questions and things that happen during clinical, and I think they have some trust in me and they think I'm very smart, and I always say, it's not that I'm smarter than you, it's just that I feel like a lot of them, I'm like, how long were you a nurse? And I'm like, oh, I've been a nurse for a year or two. And I'm like, oh, wow, like, where did you work? And then they worked on like a med surg floor, which you do get a good amount of experience on there, but you're not seeing as much stuff as you're seeing as a family care nurse practitioner. So they're kind of like they're not really connecting the dots yet because they haven't been a nurse long enough. So, one of the big things I would go is like your clinical competence, as a nurse, of why you should be giving yourself some time. So the ability to apply your knowledge in like a clinical setting, like hands-on nursing experience will give nurses, practical skills, like more of a deeper understanding of care. You also have the ability to kind of put confidence in your clinical skills as the years go by, like more proficiency with fundamental procedures, like something as simple as IV insertions can be a tough thing, but after it's like after time of giving yourself doing it. I worked in the emergency room. It took me, one of the big things I was scared of was IVs, and it did take me time to do it. Now I would say, after my experience in the emergency room and in urgent care, I could probably give an IV to almost anybody. I also worked part-time as a PACU, kind of like a PACU nose post pre-procedural for colonoscopies. But before each colonoscopy, I would give somebody an IV and a bag of fluids. So that kind of helped with that. Now, I don't know, how much you would be doing that as a family care nurse practitioner, because the nurse does do it, but I mean, it's a skill that should be honed as a nurse. Also, it helps with wound care, as you get more experience. Even the most important, I think, is patient assessments will make for a lot smoother transition from an RN to an FMP. As in my family nurse practitioner school, I will say they touched upon patient assessments, and we did go from like head to toe and stuff. But it was more of kind of touched upon for a quick semester, little bit part of the semester. While in nursing school, I think it's dug in your brain more of how to do one. And then, of course, I feel like as a nurse, I don't know, maybe it's just me, nursing school gets you ready for the NCLEX, and you kind of lose a good amount of knowledge after you start working in the field. But like, as long as you're redoing it and that repetition, like patient assessments, you're redoing patient assessments, then you're going to be great at them. And then when you transition over to that nurse practitioner and you're the one who is trying to make the diagnosis and find out what's going on here so you can come up with a proper treatment, then those assessment skills that you learned as a registered nurse become vital. They become so important, because now you're the one that's trying to figure out how to come up with a treatment plan. Also, critical thinking and decision making. After becoming a nurse, you go through this time of, depending on where you work, I worked in the emergency room, so you might hear me talk about the ER a lot and urgent care, just because of these are my experiences. But like these, the time that I had here really gave me time to come up with critical thinking and decision making skills. Even my first year as a registered nurse in the ER, I followed behind somebody who was great. She was great, and she taught me a good amount of nursing skills. And luckily for me, she was a nurse for a long time before she taught me. I think nowadays, which is another thing, I'm pretty sure nowadays, especially after COVID and so many nurses leaving the bedside, I hear of nurses in the ER who are 6 months off orientation or training new nurses. Now, how are you going to learn from someone who's just got off orientation? I mean, you can learn the basics, but like, you're not going to really be able to deep dive into the nursing world as you would with someone who's got 15, 20 years experience. So, and then to jump into becoming a family nurse practitioner with that little experience, I think it only makes for a disaster. So you want to get those critical thinking skills down, that the decision making, It's essential for all family nurse practitioners. And then you have pattern recognition. Sorry, like the experience that you get when you recognize subtle changes in patients' conditions and understand, like, okay, like, this is something I need to address with the provider. This is something we need to make sure we get an accurate diagnosis and we treat this patient correctly. Like, is this sick or not sick? And that's, I think, is a huge thing, is sick or not sick. So my first year working in the emergency room, I really needed to find out what sick or not sick was. The nurse who trained me really kind of embedded that in my brain of, like, who's sick or who's not sick. And I always remember, like, my first, like, couple weeks as a nurse, I remember going into a room with a patient who, you know, has, like, she had, like, abdominal pain at 17, and then there was a patient who was in a room and she was kind of vomiting, but it was she was vomiting blood, and it was like coffee grounds. But, like, I went in that room and I did my initial assessment. I had her hooked up to an IV. The providers were in there, and then I tried to be quick and, like, go into the room with the patient with the abdominal pain. I remember her just coming in the room and saying, like, this is not needed right now. Why are you in here? You need to get into this other room. And she was completely correct. But I was a new nurse. I didn't, you know, wasn't understanding everything behind that. But the importance of sick or not sick, you know, is really important to understand, especially going into being an FMP. I mean, even chest pain, you'll always have somebody, you know, at the urgent care, for instance, I'll say, like, people will come in and complain of chest pain, and I understand the girls up front, the medical assistants or the receptionist, they don't understand. They're not supposed to understand sick versus not sick. They didn't go to schooling for that. You know, most, you know, so I don't get mad at them for any of that. But you'll have a lot of people who will come in and complain of chest pain. Now, is it pleuritic chest pain? Is it costochondritis, you know, muscle chest pain? Or could it be cardiac? But to anybody out there, chest pain is cardiac no matter what. They always think cardiac. Anyone who's not a nurse or in the medical field, they tell you you have chest pain, it goes right to being a heart. And I know that's probably the first thing we should always think. But, you know, but this is when it comes to the skills of sick or not sick. You know, I'm not worried about the 18-year-old who's got chest pain after lifting weights more than I'm worried about the 4-year-old who was running and mom said fell, banged her head, but then an hour later she's throwing up. So you really need to kind of figure out sick versus not sick again, because you need to know who we're seeing, you know, who's in the pecking order to be seen, who's most important. So that's a real important experience that you will gain as a nurse. That honestly, I think that takes time. I don't think you're going to understand that 6 months in as a nurse. Also, you'll have, like, you know, being able to understand the healthcare system a little bit more, how to navigate, you know, the systems, experience the hospitals, the clinics, the community settings. You know, you familiarize yourself with the workflow of a nurse. You know, and this kind of will help you adapt more to working as a family nurse practitioner in the role. You know, experienced nurses are better at advocating for their patients. They understand their needs after a while. So as a family nurse practitioner, you're still a nurse. We're still advocating for our patients. At this point in time, though, we're now the provider also. You know, depending on where you are as a nurse practitioner, you'll still have a doctor maybe sign off on your paperwork or check your patient. I know in the urgent care where I'm at, after the nurse practitioner sees the patient, they usually kind of go to the doctor as if they're a resident in a way and give their take on the patient's condition and what the diagnosis could be and how they could treat it. And then sometimes the doctor will kind of go in, and depending on how serious it could be, they'll do their own assessment again, and the doctor still has to kind of write off on the note. So with the doctor still, you know, being able to go into that room and sign off on your paper, sometimes at the end of the day, they still have the end say. They can change your treatment plan. So as the nurse, you will gain that experience of how to advocate for your patient. So sometimes, even at a provider world, the doctor, we all know as nurses, sometimes the doctors don't understand what's best for the patient. They can treat the patient perfectly fine, but sometimes they don't know what's best for them, and that's when our advocacy comes in. And you still need that experience to be able to advocate for that patient, because as a family nurse practitioner, you're working closer with the doctor sometimes than the nurse is, and you really need that experience on being able to advocate for your patient to entrust patient safety. So that's another reason why we should have experience as a registered nurse before going into nurse practitioner school. Professionally, you have the growth and maturity as a registered nurse. You'll be able to manage patients independently as a bedside nurse with more confidence. So this will transition well into becoming a family nurse practitioner. Your first couple months as a nurse, even maybe your first couple years, I don't know what nurse isn't, but for me, I was scared. You're scared going into them rooms. I was scared going into those rooms as a emergency room nurse. I was grateful to have a preceptor that was amazing. I was grateful that she had my back. But the moment I was by myself, and this was probably 4 months in, 5 months in, the moment I was by myself, I was scared. I was asking people all the time, like, hey, like, what do I do here? Can you help me? Can you come into my room? I have this going on. Can you, and they were, we all got together as a team to help. But after a while of me being in the emergency room, I would get patients that, I just had them, like, I was very confident, and which was great. Like, I wasn't, like, too confident, because you never want to be too confident. That's when shit might hit the fan, when you're just too confident and you think you know everything. Because none of us, especially in the healthcare world, none of us know everything. There's always learning and learning and learning. And the moment you think you know everything, that's when something's going to go wrong and bite you right in the ass. But going back to what I was saying, like, that professional growth as a nurse, you really need it. So then, as that FNP, you can become more confident in going into these rooms. If you never worked as a nurse, or you worked as a nurse as maybe a year, your confidence is going to be at an all-time low. So now, when you're the provider, how are you going to be confident? How are you going to be confident going into that room and then walking out thinking, like, I treated this patient right? And how's the patient going to feel? Like, if you go into a room as the provider and you're not confident, they might be like, I don't know, like, should I be here? Should I go somewhere else? Maybe I should send me the doctor. That's what they'll be saying. Send me the doctor. And then it will be a whole argument, because you don't have any confidence, because you didn't work long enough as a nurse to build that confidence. And I can't blame this. I'm not trying to make this a video on blaming this on the person who hasn't been a nurse and decided to go into nurse practitioner school. I'm not saying anyone cannot do it. I'm sure we can all do it. I'm just saying how important the experience is, and maybe we should look more into this before accepting people into nurse practitioner school. Like I said, I believe that nurse practitioner schools need to change in their acceptances. I believe that you should be a nurse for a minimum of 5 years before becoming a nurse practitioner. I mean, it's to say, it's like because you're a provider. It's like a doctor. You can't, you won't have a doctor go to medical school, pass, and then send him out as the head, on call or not on call. I'm sorry, as the head physician. You're not going to send him as the only physician or the attending. He's not going to be the attending fresh out of school. They get 4 years of residency. 4 years. 4 years of going through different rotations, finding out where they fit in the medical world. They go through 4 years of that. They have hit every spot. As a nurse practitioner, sometimes you have to find your own clinical spot. And if you don't find a good one, and you could be really screwed. Like, I've seen clinical spots where, unfortunately, you're used as a glorified medical assistant. Like, you're an extra worker. Sometimes they don't even want to be bothered with teaching you. So you need to find your own place, know where you're going, find someone that's going to suit you, and then kind of go there. Because, like I said, you could be if you don't have any experience as an RN, and then you go right into nurse practitioner school, and let's say you get put into a clinical space that they don't really teach you well. They want you to do vitals, and then they don't really ask you the big questions of what would you do in this scenario. They're kind of like going through their day and using you as hired help. Then, man, you're going to be really screwed when you come out. You're going to graduate and you're going to be, ready to work as a family nurse practitioner, but you're going to have like no experience. And, we all don't have experience as a nurse practitioner when we come out, obviously, but you're going to have no medical experience at all because you didn't really build your experience as a nurse. Because nurse practitioner school, is, off the basis is you're a registered nurse. It's off the foundation that you're a nurse. It goes through certain, I learned certain things, the pathophysiology of, goes a little bit deeper into pathophysiology, goes deeper into, treatments and stuff. But these are things also going off the basis that you already know. Like, what CHF is. You know why we give steroids. You already know, like, why, what are the side effects of giving steroids? Do we, especially with people with diabetic, we know it raises their sugars. But someone who has no experience and they go into trying to learn a lot of this stuff, it could be a really hard time. I feel like not anyone, but a lot of us can be book smart. A lot of us can sit there and read through a book and take a test and kind of pass it if we put enough effort into it. But that on-hand experience, that's priceless. It's priceless to me, to be that on-job experience. Now I'm suturing. Like, I am scared to death to suture. I have been practicing at home. I have my little kit, but I also hear from everyone it's not the same. Hence one of the reasons why I definitely put myself as my last semester into an emergency room so I can have that experience, draining abscesses, doing sutures. I want as much of that experience as I can get, because as the student, you can I don't want to make a mistake, but it's not as frowned upon if I make a mistake. There's someone there to help me. As the provider, I can't really make a mistake. This has to be done. So, very important for the experience as a registered nurse. So while FNP school, like I said, they'll teach advanced skills like diagnosis, treatment planning, pharmacology, but prior nursing experience will bridge the gap between like the theoretical knowledge and the practical application. It kind of ensures the FNP that they're not just academically prepared, but clinically competent. They're empathetic and confident in delivering high quality care. So anyway, guys, I'm going to end this video here. I just kind of wanted to make a little rant about the importance to me of experience as a registered nurse. And are you deciding to go into family nurse practitioner school this year? If you're watching this, let me know in the comments of what your experience is. Are you already in FNP school? Or how long have you been a nurse? How's your nursing? And do you feel like you're ready to go into FNP school? Well, anyway, guys, like I said, there's a lot of pros and cons to family nurse practitioner school. I do believe experience is the biggest thing you need as a nurse to go into nurse practitioner school. There's also pros, there's also cons, and maybe in another video I'll go through the pros and cons of nurse practitioner school. But other than that, guys, any questions you have about nurse practitioner school, leave it in the comments. Any experiences you have, leave them in the comments. I would love to read them. Other than that, guys, thanks for watching the video. I appreciate it. Have a good one. Bye.